What's up, rookies? Welcome to another snippet on what pharmacists do. Today, we're going to talk about veterinary pharmacy. And to do that, I am so excited to have with us Truman Cheung. Truman is a long time friend of mine. We should tell that story a little bit about how we met and didn't even know that we met. But I know I officially met you as a pharmacy student when you were on rotation, on your transitions of care rotation at our facility. You were one of our awesome students. We loved you. And I recently posted a video about celebrating American Pharmacists Month and inviting pharmacists and students and technicians to come on and, in honor of Pharmacy Month, share what their impact is as a pharmacist or pharmacy technician or pharmacy intern. And Truman, I'm so grateful you answered that call and you messaged me and you're like, I'm going to talk about veterinary pharmacy. I know you had recently graduated, but I kind of lost touch with you and I didn't know where you were working and what you were doing. So this is going to be an occasion for me, an opportunity for me too, to connect back with you and see what you're up to. So Truman, thank you so much for answering my call. Welcome. How are you doing?
Yeah, thanks, Brigitte. I'm happy to be here. Thanks for having me. I'm doing well.
Yeah, you look well, and I'm excited that you're here to talk about veterinary pharmacy. I can count on my fingers how many veterinary pharmacists I've met, and you probably know them. So can you tell your listeners about your journey into pharmacy and your career? Why did you decide to become a pharmacist in the first place, and how did you end up in veterinary pharmacy?
Yeah, so my journey really starts from about high school. I got my
Okay.
first job as a math and science tutor for my school. And
Mm.
through that job, I found out how much I enjoyed helping my classmates and really explaining difficult concepts to them. I thought, oh, this is really fun. I really enjoy
What a
doing that.
nerd.
It's better than most jobs, so I got to say that,
Okay.
and especially throughout high
Pharmacy
school.
tutor, and then what happens? I mean, you're a math tutor, not a pharmacy tutor in high school, right?
Right, right. And so, through that, I also discovered my love for math and chemistry. And I
Okay.
wanted to find a career that could really sort of merge those two things together. And through my research, I thought, oh, pharmacy would be a great place
Yes,
to really have
absolutely.
that experience.
Absolutely. Okay.
Exactly.
So what school do you go to?
I went to, well, for high school or for
Pharmacy
pharmacy school?
school. We're talking about pharmacy here.
For pharmacy school, I went to Toro University up in Vallejo.
Woo! Shout out. That's the same school I went to. So shout out to all the Turians out there. Yeah, so you go to Toro and you graduate in 2023, just this past May, right?
Just this past May, so I just started working as a staff pharmacist with my veterinary pharmacy
Okay.
just last week.
Yeah, congratulations on your new job. But how do you end up there? What gets you interested in veterinary pharmacy?
Yeah, well, I can say that it's not really a traditional thing for most people to have that kind of
It's not.
experience.
It's not.
It certainly wasn't something that I really would say that I like, oh, I set myself up for this exact path. It wasn't really something
Mm-hmm.
that I was thinking about. It just so happened that when I was looking for a job in pharmacy as a technician, I was wanting to do something that was a little non-traditional, not your normal working in
Mm-hmm.
CVS or Walgreens. I
Okay.
stumbled in compounding, at a small pharmacy up in Walnut Creek. And I
Uh-huh.
was there for a couple months and then said I wanted to move on. And I found this veterinary pharmacy up in San Rafael that was also doing compounding. I'm like, oh,
Okay.
well,
Okay.
maybe I can leverage my skills and actually, work here. And long story short, I've been with this company for on and off for about 7 years now. So it's been
Mm-hmm.
2016 now.
Yes. And we talked before we went on the record, we talked about how I worked there when that same year that you started, I worked there as a pharmacy resident. And that I started in July and you started in September of 2016. And we crossed paths probably a lot of times and we never realized it. But I always had a feeling that I had seen you somewhere though, like when you were on rotations with us, your face just told me something, but I just couldn't put a finger on it. Now I know what it is. So you and I, we probably cross paths along the way at Golden Gate Pharmacy. So
Right.
you work as a pharmacy technician while you're in pharmacy school, then you become a pharmacy intern, obviously, at Golden Gate, and you graduate. and you get an offer as a staff pharmacist.
Yeah, exactly. I mean, I'm really excited that
Congratulations.
they're bringing me on, and we have a long-standing relationship with this company, so I'm just really
Yeah.
happy to be able to serve them in this new capacity.
Yeah, yeah. Congratulations, Truman. I'm so happy for you. Um, what I like to ask my fellow pharmacists every time I speak to someone about this is what is the most rewarding aspect of being a pharmacist? Particularly if you can narrow it down to the field of veterinary pharmacist also.
Yeah, and that's a good question. Pharmacists, I think, are in a really unique spot, especially in the veterinary care. We are the only healthcare professionals that are expected to care for just any species, right?
Thank you.
We have pharmacists in
Mhm,
humans. If you
mhm.
work in a CVS or Walgreens, you've likely filled the prescription for a dog or for a cat. Of course,
Yes,
we as pharmacists are expected to know, how to
yes, yes,
giving it
yes.
appropriately,
Yeah,
doing it correctly.
yeah. Oh my gosh. I never thought about that, that we
Yeah,
work with every species.
the only healthcare professional that does
The
that.
only healthcare professional. Because if a pet shows up at the ER where I work, we're gonna say sorry, no. But if a pharmacist at Walgreens gets a prescription for a pet, you bet you that we're filling that prescription. So
Oh, yeah.
that is a great point. Pharmacists are the only healthcare professionals that work with any species. And ooh, I'm gonna start using that as a selling point. I mean, it's so true. It's so true. Um, Thank you for sharing that. Now, can you walk us through? Now, let's get into the meat of veterinary pharmacy. Could you walk us through a typical day in your life as a veterinary pharmacist?
Sure. I can only really speak to my personal experience with my
Yes,
pharmacy.
yes, yes,
Of course.
absolutely. Yeah.
So our setting is very much like a community setting. Uh, I would say, best way to describe our pharmacy, it's a closed door pharmacy. We're
Okay.
primarily a mail order pharmacy.
Mm-hmm. Mm-hmm.
So a lot of the tasks that we do as pharmacists are mostly just on the clinical side. Really, we're assessing whether or not the dose is correct for a patient. We also, of course, intake prescriptions, we dispense medications. But a lot of
Mm-hmm.
the time, you know, I think what's unique about my position at this pharmacy
Mm-hmm.
is that we do have the time to assess whether the medication that's being prescribed is appropriate. We have the time to do the
Mm.
research, look up the studies, make sure that if we're prescribed a dose for, like, let's say it's an exotic animal, like a bird or a
Oh my
hamster,
goodness.
or even a
Yeah.
zoo animal, a tiger,
Yeah.
we
Yeah.
have the time to sort of assess, okay, is this appropriate or is it not appropriate? And do we need to call the clinic to make sure that they're aware of the dosing? So I think that's puts us in a very unique spot to be able to do things like that, something that you wouldn't be able to do, let's say,
Uh-huh.
at your
Mm-hmm.
local
Mm-hmm.
pharmacy. They
Yeah.
won't have the time to research that.
Yeah. I have 1,000 questions running through my mind right now. What drug resource do you use to determine if the drug is appropriate for the species that you're getting a prescription for?
Yeah, so that's a good question. We have something called plums. Uh, that's sort of like the up to date for the veterinary world.
Oh
So
my gosh. Okay. Okay. PLUMS?
Plumbs, plums.
Plums. I'm gonna
Yeah.
check it out. See, we learn something every day. Oh wow.
It's
So,
it's
so
our
the,
lifeline in this field. That is our resource. We require it. We need it. We can't do
okay.
anything without it.
Wow. Wow. So you did mention that you work in a closed door setting, meaning people don't walk in and out, kind of like at Walgreens. But you're more on the clinical side, reviewing the orders, taking in the orders from the providers, making sure that they're appropriate for the patient. And then what about the actual making of the order, the filling and of the prescription? Are you involved in that process too, the compounding process?
The compounding now that I'm a pharmacist, not so much.
Okay.
But we do have a team of incredible technicians that we work with, and
Yes.
they
Yeah.
are amazing.
Okay.
Without them, we cannot do our work. We
I've
cannot
said
keep up
it.
with their
I
speed.
have
They're
said
just
it.
incredible.
I have said it so many times. Pharmacy technicians do all the work for us, and we really have to appreciate them as much as we can. And as part of pharmacy month, there is a pharmacy technician day, and I always take time to celebrate my technicians that I work with on that day. So that's very important that you mentioned that, and I appreciate them, like that. So when they compound, do you I know with us in the hospital we have the pharmacists, our technicians compound as well, but the pharmacists do like a final verification check. Is that the same case on your end?
The exact same case. So
Okay.
usually we actually have two checks that go towards the final check of the compound. We have one of our pharmacists, our lab manager, who checks them before they get dispensed out to us. Then we
Mm,
do a final check to make sure it's labeled correctly. The product looks
got you.
and
Got you.
everything
Got you.
about the product looks
Got
good.
you.
It's ready
Got
to
you.
be
Got
bought.
you. Okay. So it's the same process as for humans, but in this case, you're working with pets and animals that are different. They have a different physiology and biology, and I'm glad you have that drug resource to do your clinical reviews. And I'm sure there are other resources that you cannot all name here. So that is one distinction that you mentioned. But can you think of any other distinctions between human pharmacy and veterinary pharmacy? And can you provide some common examples of medications and treatments in your niche?
Yeah, I mean, I would like to say that, veterinary pharmacy isn't as scary or different as you might think it is.
It
In
sounds
a lot of
fun.
ways, in a
It
lot of ways, I think
sounds
it's similar to like pediatric patients. A
fun.
lot of the doses are
Mhm.
generally a lot smaller than, your adult human. Like,
Right. Okay.
yeah, a lot of our medications are also weight-based, just like pediatric patients are. Now, there are very few medications that we use that aren't actually weight-based, and those usually depend on like blood levels. And, we rely on our veterinarians to be able to uh, basically assess, whether or not that's appropriate.
Okay.
And
Okay. You mentioned blood levels, so the veterinary do labs like they
they
do for
do. Exactly. So, for example, like a lot of older cats, they have a condition that causes their hypothyroidism, basically. Very
yeah,
common
that's
condition
common.
in cats. For them, as you know, with a drug like methimazole, you need to take levels. In humans, I believe we use TSH as the
Yeah,
assessment, but
yeah.
veterinary care, we use T4 levels.
Okay,
Generally,
okay.
a
That
little
is
bit different.
distinction. Yeah. Do you have access to those labs, or do the veterinarian send them to you with the orders?
Yeah, unfortunately, based on the setting that we work in, we generally don't have access to those labs. But if we have questions about the prescription that we're getting, we can usually ask, and generally we don't have to because our veterinarians are really good.
Yeah,
They're
they're really
really
good at keeping track of those. Okay.
exactly. So we don't really have to worry about it as much as long as the dose is within an appropriate sort of range.
Okay.
It doesn't seem too high or too low. Then usually
Okay.
we're okay with it. So
Okay.
there's a lot of collaboration, right? That
Yeah,
we trust
of
our
course.
veterinarians
Just
to do their
like,
due diligence.
just like, yeah, just like in the hospital and in clinics and lots of collaboration has to be done between the pharmacists and the other healthcare providers involved.
Right.
You mentioned methimazole. Can you name some other drugs that you feel quite often in your practice?
Yeah, I mean, our pets are not much different than we are. They also, enjoy the same chronic and acute conditions that we do. So we
Mm,
fill a lot of antibiotics for our patients, a
okay.
lot of hypertension medications. We'll even see heart failure. If you see
Oh
a,
my gosh.
yeah, I know it's sad, but it happens. And you know it's heart failure when you get the whole list of
Okay.
4 or 5 drugs that have to go along with them. Well, I think what's unique about veterinary care, though, is that we generally don't have much in the way of guidelines. Oftentimes it's based off trial and error, see what works and what doesn't. Uh,
I got you. I got you. And one last question. Are your patients um pets from homes, or are they in farms? Like what kind of settings do they come from? Like, from all over?
Definitely a majority of them are cats and dogs. So, the people who raise
Okay.
them and
Okay.
your family pets, those are,
Yeah.
I would say, make up 95% of all of our
Got you.
prescriptions.
Got you.
But
Got
we
you.
do we do fill prescriptions for hospitals. We also, well, not prescriptions, but they're more orders. So they're
Okay.
more like for patient use.
Okay.
We also
Okay.
for zoos. I think those come by
Okay.
every now and again.
Okay.
You
Okay.
see
Okay.
tigers, you
Okay.
see gorillas, penguins.
Really awesome. Okay. 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 Do you ever get your patients' pictures in the chart?
Sometimes the owners might send pictures to us, so that if they're
Yeah.
grateful for our service, they're like,
Yeah.
"Hey, this is my
Yeah.
dog, this is my cat. Here's a picture of
Oh my
them."
gosh. Okay. Okay.
It's so nice to be able to see our patients from time
I
to time.
know. I know. I know. That would be my favorite part, to get to see the patients and pet them and hold them and and just, but this is such a cool and unique field that people don't hear pharmacists involved in as much. So I'm glad you're here to shed the light on this amazing pharmacy career path. So I think my last question for you would be, what advice do you have for pharmacy students or pharmacists who are interested in pursuing a career in veterinary pharmacy? And I wanted to ask you, is a love of pets a prerequisite for this? How do you feel about pets? Do you have any pets? Is that at all part of what drew you into working in veterinary pharmacy at all? So that's kind of two questions. One is just for my own,
Hmm.
knowledge. Do you love pets? Is that part of you getting involved in this field? And then the second part is the advice part. Okay, I'm done talking.
Well, the funny thing is, I actually haven't raised pets in a long time. I think we used to
Okay.
raise like goldfish or turtles before, but just recently, actually, these past 2 weeks, we've had a stray cat that's been wandering our backyard, and I've been taking care
Mm,
of that. We've been feeding her a lot. She comes
okay.
back every day, so actually, in about 2 hours, I'm sure she'll show back up, and she'll be waiting for food right outside our backyard.
I've had that happen. I've had that happen. And I have two young kids who have been begging me for dogs.
Oh
And
yeah,
it's so much work, but I love them and the kids love them. So maybe
yeah.
someday soon. Okay. All right. So what
But for
advice
me,
do you have?
yeah. Well, for me, I think a lot of the passion really comes from being able to take care of a patient population that generally cannot advocate for itself. They
Mm,
can't tell you whether they're in pain, what's going on. It's
mhm,
it's a lot of collaboration that has to happen between the pharmacy, the veterinarians, and our pet owners.
mhm.
We sometimes even, I like to say that sometimes we have two patients really. We have the owner and the patient, the pet.
True,
We
true.
have to consider the
Yes,
owner's limitations and all that
yes,
as well as
yes,
we're taking
yes.
care of the patients.
Yeah, yeah, yeah. It's really like taking care of babies, because you have the baby who is your patient, but then the mom or the dad is always there,
Mhm.
concerned about and wanting to be in the loop with
Right.
the care of the patient.
Yeah. And
Um,
then the second question is about advice, right?
yes.
Advice. Wow. So I would say, especially if you're a pharmacy student, if you can sort of find a rotation, or
Okay.
shadow at a veterinary pharmacy. I know for
Mhm.
us, we used to take students on, but then
Yeah,
lately we've had some internal changes going on right
yeah,
now. So
yeah,
we're currently
yeah.
not taking any students, but that's
Mhm.
something that I'm looking forward to. Hopefully one day we'll have students again.
Yes.
So
Okay.
kind of open it up. So open up to pharmacy students.
Yeah, that's a good point. That's a good advice. Amazing advice. Just like with anything you're interested in, try it out first in the form of volunteering, in the form of doing a pharmacy rotation while you're a student, to kind of confirm, if this is something that where your heart really is.
And it's not for everybody, so you definitely have to try it out first.
Okay.
And
Okay. Okay.
yeah, and for pharmacists, I think there's a lot of continuing education that you can look into if that's something you're interested in. I know that resources aren't as, easily accessible as it is for humans, but I
Yeah.
know there are there's always, some sort of continuing education that's out
Yeah.
there. Conferences for
Yeah,
sure.
yeah, yeah. Okay, 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 okay. So I heard two things. I heard, confirm your interest, go out and volunteer um in the setting in the veterinary pharmacy, or go out, and as a student ask about rotations, possible rotations available in that setting. That if you're a student. Some people can get a job as a pharmacy technician like you, because it's highly recommended as a pharmacy student to have some kind of pharmacy experience, right? It helps with going through the curriculum, and it helps with narrowing down your interests. as you move on
Right.
along in your career. And then continuing education, always a good thing to do. Whether you have found the field that you're interested in, you have to continue to learn and be on top of changes in guidelines. And particularly if you're interested in a new field, you do want to go out and find conferences like you mentioned, CE courses, and yeah, that those are great ways of knowing what's going on in veterinary pharmacy, and confirming your interest. All right, there you
Like,
have it, guys.
the most important thing is probably even networking, just connecting with other
Ah,
people.
yes,
That
yes.
is
I'm glad you
huge.
said that. You cannot get out of networking. I mean, networking, it's just good to do. It's fun to do, and you just never know where it's gonna take you, you know.
Exactly.
So it's easy to do. Just do it. Just be friendly with people, ask questions, go out to CE dinners and ask, just network. There's so many ways you can network, and that I'm so glad you added that, because I was gonna say that at the end too. Because now that our listeners know that we have a veterinary pharmacist, on the show, I think you'll be okay, right, with them reaching out to me or you if they have any questions for you about, about your career path, and if they need any help.
Yeah, please, my emails, my phone is always open to, anybody who
Yeah.
is interested. I'm
All
happy to
right.
connect and, talk.
I'm gonna attach that to I'm gonna not attach that, but I'm gonna type that into the notes, the show notes below for anyone interested if you have any questions. So thank you so much, Truman, for coming on and sharing the wonderful world of veterinary pharmacy with us on this October, which is American Pharmacist Month. And I really love what you say about pharmacists are the only healthcare professionals who can take care of any species, any age.
Exactly.
We can even add any age, anything. So in providers in any field are going to see their patients, but they're going to order prescriptions, right? No matter
Right.
what field they're in, whether it's for a pet or a baby or a specialty like podiatry or ophthalmology, they're going to need some type of medications. And those orders all come to the pharmacist, and we make sure that they are safe and effective and appropriate for our patients. So I thank you so much for coming on and spreading the word about veterinary pharmacy. Guys, if you really enjoyed this video, please subscribe so that you can be alerted every time we make a new video. And until the next one, everyone, stay blessed. Bye-bye.
Thanks for having me.